बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लम व सल्लिम अलैहि। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. Today, I am going to show you the normal anatomy of the gallbladder and how to scan the gallbladder, what would be the position of the patient and position of the probe. Now the patient is in the supine position and I have placed the probe at the epigastric region. And in the epigastric region, when we place the probe, we can see the liver. This is the liver, and at the epigastric region, this is the left lobe of the liver. The probe should be making 90 angle with the floor, so then we can appreciate the left lobe of the liver. Then slightly drag the probe toward the lateral side. When we reach the lateral side, while the probe is in longitudinal direction as it was previous, we will see this black structure, which is the inferior vena cava. At this position, then we have reached the right subcostal region. Costal means below the ribs. So when we reach here, then tilt the probe as I am doing. Tilt the probe toward the right shoulder of the patient and slightly drag the probe further lower to have better visualization of the portal vein. This is the portal vein. When we have done such maneuver, so when we have done the such maneuver that the probe is at the subcostal region, and then we have angled or tilted the probe toward the right shoulder of the patient, we will have such kind of picture in which the liver is present, this black tubular structure is, the portal vein is present, and this pear-shaped structure, which is also black, is the gallbladder, and this one, linear structure, which is connecting the gallbladder to the portal vein wall. This is the main lobar fissure. So this maneuver will help to show all these things. So we can appreciate the gallbladder at this level. This area, this area, this whole area is the body of the gallbladder, which is lying in the gallbladder fossa. अब जो गॉल ब्लैडर है वो पियर शेप्ड होता है, नाशपाती की तरह, और उसका आपने कभी ये देखा होगा कि आम के दरख्त को, जैसे आम का दरख्त, आम जो है ना वो लटका होता है शाख पर, ब्रांच पर, उसी तरह ये जो गॉल ब्लैडर है, इट इज हैंगिंग at under surface of the liver. तो उस तरह क्या होता है कि ये हैंग हो चुका होता है एंड इट्स fundus is upward while the neck is sorry neck is upward, that is the proximal portion, and then the where it is attached to the cystic duct, and the fundus which is the distal portion, this one I am going to show it also. Fundus, it is hanging downward, ये आम की तरह लटका हुआ होता है. So it has three parts. Number one, distal portion which is hanging at the under surface of the, which is the visceral surface of the liver. So is the fundus. Then the major portion which is lying mainly in the gallbladder fossa, which is present at the under surface of the liver, is the body of the gallbladder, and then is the neck of the gallbladder, which is connected with the cystic duct, and then also the main lobar fissure, which is this. It is also connecting the portal vein wall with the gallbladder. So we will see all this. So this is the one probing position of the ultrasound to see the gallbladder. Another portion, if there is a sometime the patient is not in fasting position, मतलब I mean to say कि उसने खाया पिया होता है recently, तो फिर gases होती हैं, तो we can feel difficulty to visualize in this maneuver. So then we put the probe at the lower intercostal space region. जो रिब्स होती हैं दो आखिरी लास्ट वन, तो उनके दरमियान में स्पेस मिल जाती है, तो हम फिर प्रोब को वहां रख लेते हैं. दैट इज द इंटरकास्टल स्पेस. जब हम प्रोब को वहां रख लेते हैं, व्हेन वी प्लेस द प्रोब at the intercostal region while the patient is in the decubitus position, then also we can see the gallbladder. We can also feel difficulty when placing the probe at this level due to the rib shadowing. So now at this level again we can appreciate this is a pear-shaped gallbladder which is having fundus at its distal portion. ये हैंग हुआ पड़ा है at the under surface, जैसे आम होता है, जैसे कोई भी फल फ्रूट होता है जो हैंग होता है, ये this is like this. And so this is the fundus which is rounded, and this is the body, and this is the lower proximal portion with the neck, and this is the liver. So in this maneuver we can appreciate the gallbladder in this way. Then if we feel difficulty again, we should also ask the patient to turn with the left lateral decubitus position, mean the right upper limb of the patient should be at the upright side, and the left upper limb portion should be toward the floor side. So now I'm asking the patient to turn. So now I have asked the patient to turn it. Patient is now on the left lateral decubitus position. The best technique to scan the gallbladder is ask the patient to have a fasting for the 6 to 8 hours. Then the gallbladder will be distended, and it will be easy to see the gallbladder while the gallbladder will be dilated. So now I have tilted the patient in lateral position. We can zoom the image also to see better visualization of the gallbladder. Here we can appreciate the pear shape. So it is not looking like pear shape. It is looking like a tubular structure. So depending upon the position of the patient. So here this which is hanging downward distal portion is the fundus, and this is the body, and this one is the neck of the gallbladder, which is just in this position, is separate from the body. However, it is attached to it, and this gallbladder normally will be having bile that is produced by the liver. So this bile would be black. As we see the urine and the urinary bladder that is black, so the normally gallbladder appear as a black pear shaped or this shape like structure. It should be clearly black and aqueous, and it should give the posterior enhancement, acoustic enhancement, like as we are having this one. This is the enhancement of this structure. So posterior, it is called posterior acoustic enhancement, which is a artifact of the ultrasound. And it has two walls. This is the anterior wall and this is the posterior wall. Always measure the thickness of the wall at its anterior side while zooming the image. This should be thin, smooth to both walls, and these should not be more than 3 millimeter. So wall thickness normally should be less than 3 millimeter at all the area. It should be diffusely thin walled. It may be thick walled diffusely or focal, but it should not exceed the 3 millimeter. So it should be black and aqueous, filled with fluid. No internal echoes should be here, and the wall should be smooth. So when we ask the patient to have a decubitus position, we should also look the neck of the gallbladder. This is the gallbladder, and here this is the body, ending of the body, and then it is the neck of the gallbladder starting from here. Here is the Hartmann pouch, small pouching where the stone mainly large and we miss it, and this can cause the while stone is lodging in the Hartmann pouch or the neck, it can obstruct the outflow of the bile, resulting in the cholecystitis. So this then neck of the gallbladder, this one neck of the gallbladder connect with the cystic duct, which is hardly visible. Maybe this one, this smaller here, this maybe this area, this one cystic duct. No, we are not sure because it is not dilated here. However, this cystic duct connects with the common hepatic duct. Common hepatic duct is formed by the combination of the right and left hepatic duct. Then this common hepatic duct reaches at the level of cystic duct and combined with the cystic duct to form the common bile duct. So this cystic duct with the common hepatic duct form the common bile duct. As we can appreciate, there are normal variation in the shape of the gallbladder, and also here we can appreciate some line between the neck and the body. This is a junctional defect. This is called junctional fold or defect. So many variation are here. We one variation is the uh, Phrygian cap, which in which the this fundus is folded on itself, forming a cap here. This is also normal variation called the Phrygian cap. This bladder may be septated. Two gallbladder may be present. Honeycomb appearance of the gallbladder may be where there will be multiple septation. So these all are the normal variation of the gallbladder. This gallbladder may be located on the left side when there is a situs inversus. So this is the normal. This gallbladder is supplied by the cystic artery. The walls are supplied with the cystic artery, which is the branch of right hepatic artery, and then this cystic artery gives two branches, anterior and posterior branches that supply that uh, come and into the calot triangle. There is a triangle at the porta region called the calot triangle. ये ब्रांचेस फिर वहाँ होती है, वहाँ से ये सप्लाई कर रही होती हैं गॉल ब्लैडर वॉल्स को. तो ल्यूमन में कोई सप्लाई नहीं होती, वॉल्स में सप्लाई होती है. एंड वी कैन अप्रिशिएट व्हेन वी यूज अ कलर डॉपलर if there is a sometimes in the normal gallbladder is hardly to appreciate the uh, blood flow within the cystic within the branches of the cystic artery. So when there is a cholecystitis, hyperemia is there, we can appreciate. So this was about the gallbladder normal anatomy. So when there will be the pathology, we should remember the shape, black, blackening of the gallbladder, smooth walls, acoustic enhancement, no internal echoes. And also then this is the longitudinal view, we can also have the transverse view of the gallbladder. Look here, it will appear like this. This gallbladder normal length is 5 to 10 centimeter, and if it is more than 10, then it is distended. फिर हम उसकी वॉल थिकनेस देखेंगे और उसका अडीमा देखेंगे, पेरिकोलसिस्टिक अडीमा, जो कि बिल्कुल छोटी छोटी ब्लैक डॉट्स नजर आएंगी आपको वॉल्स के बाहर, तो ये अडीमा कहलाता है. And if there is a difficulty, we can ask the patient to take a deep breath and hold it. Then it will also easy for the sonographer to get better visualization of the. This is the we can appreciate the neck. So whenever you have such position of probe, you can tilt the probe or angle the probe to have the visualize to so that we can appreciate the gallbladder from the fundus to the neck of the gallbladder. Neck is the main culprit where the stone can be hidden. So in every scanning of the gall, even normally, we should also see the gallbladder neck so that we can clear the neck of the gallbladder from the stone. And सीधे दियो लंबा सा आगे रोको. So now patient is having the deep breath and hold the breath. So then we can easily look at the gallbladder. This one is the, and then this at the portal hepatis we can appreciate the portal vein. This one black structure is a tubular one. It will show the color uh, to differentiate it from the gallbladder because portal vein will show the color and gallbladder will not show the color. And anterior to the this portal vein is the cystic duct, sorry, common bile duct, which is very difficult to appreciate when it is not dilated. So this may be the common bile duct, maybe the hepatic artery. Then to differentiate, we can put the color. So we can see it if it is a. So look at the portal vein is showing the color, and look here, this structure black is not showing the color, so it is a common bile duct. It is located anterior to the portal vein. So we can differentiate it from the hepatic artery and portal vein while putting the color. So whenever there would be the pathology, we should remember the shape of the gallbladder. What is the shape of the gallbladder now, which we have seen now? It is a normal gallbladder. So फिर pathology में we have thick walled gallbladder, internal echoes, which is called sludge. Stone may be present, which will give the shadow, and also mass may be the present, and there may be polyp, and also passive hepatic congestion will cause the thickening of the wall of the gallbladder, and many other conditions we will come across whenever I will get some pathology. So this was all about the normal anatomy of the gallbladder. The function of the gallbladder is only to store the bile, concentrate it while absorbing the water, and then also also and also it contracts while after the food intake. Again, this hanging portion or distal portion is the fundus, major portion is the body, and this paroxysmal portion, which is close to the portal vein, is the neck of the gallbladder. This was all about the normal anatomy of the gallbladder. Thank you very much.